You may be concerned that you have abdominal separation during your pregnancy or afterwards, but what is it and why does it happen? So when we are pregnant, we have a hormone on board called relaxin, and its job is to create some pliability in the tissues of our whole body, actually, so our pelvis can spread out a little bit better to allow the baby to come out. And also it gives us space and creates softness in our abdominal musculature so that the baby can grow forward. And we have a six-pack muscle that goes down the front of our tummy, and that's called our rectus abdominis. And when we are pregnant, the baby has to grow forward, and we have an expanded abdomen, and those muscles will separate. So we'll have instead of being side by side, they'll go out like this. And that's a normal function of pregnancy. But afterwards, when we have the baby, at around 8 weeks, we may notice that we still feel like we have not much strength in our abdomen. We may feel like there is separation there still. And that's called a diastasis or a diastasis, depending on which country you were trained in or where you're living. And it's the separation of the rectus abdominis muscle. So a diastasis of the rectus abdominis muscle. And it's a problem when if there's too large a separation. So what's normal? When you come to see a women's health physiotherapist, they'll have a feel, usually at the umbilicus, at the tummy button, and they'll see how much separation there is. So is the rectus abdominis coming back together? Everyone has like a little bit of softness right at the umbilicus. But we are looking at around 8 weeks to have about 1 finger separation to 1.5 fingers. And that translates approximately to 1.5 to 2 centimeters. Now, when we have more than that, say more than 2.5 centimeters, then we're thinking, we better really start using some strategies to get more strength and to start knitting that tissue back together again. Because when we have too much of a separation, say if it's 4 centimeters or lower, we can really work on muscle strategies. If it's more than 4 centimeters, sometimes we have to use binders and other muscle strategies, and even talk to your doctor about further intervention. We don't want a separation there because it creates back pain. It can create pelvic floor dysfunction. So we can have more hip pain. We can have things like more incontinence, a harder time stabilizing with coughing or sneezing. We can even have pain with intercourse. And the most common is the back pain. That's where people feel like they just don't have the core anymore to stabilize their back when they're, say, lifting their baby out of the crib. They might feel more discomfort and fatigue in their low back. So when you see a pelvic floor or a women's health physiotherapist and they notice that you have a diastasis, they'll give you some strategies. And one of the main ones we want to do is get the transversus abdominis muscle, get that muscle going again. So what is that? It's your deepest core muscle of the abdominal muscles. There are some muscle exercises, abdominal exercises, that if you do those, they actually can inhibit the muscles coming back together again. So we want to make sure that we're using the right muscle systems, the right exercises to get the muscles back together. One of the easiest ways to doing that is getting you to do some proper Kegels. Now, many of us, when we have a significant diastasis, diastasis, I'm going to go back and forth today. When we have that separation, about 70% of women cannot do a pelvic floor contraction properly. They have a really hard time finding their Kegel because of the dysfunction in the abdominal system. Because the core, it works as a functional group. So if you have a problem with your separation of the tummy muscles, you often will have a problem with your core inferior system, which is your pelvic floor. But if you start doing some Kegels, just gently doing a Kegel and learning how to do a Kegel, that is one of the strategies that we tend to use when we have about a 4 centimeter or less separation of those muscles. So you would do a Kegel before you do something like a lift, or go from sit to stand, or roll over in bed, because that's usually when we notice the effects of the diastasis. So what does it look like Well, when you are lying down on your back, if you were to lift your head up and maybe a little bit of the shoulders up off of the bed, you may notice that you get tenting or a ridge of muscle that runs along from the top of the abdominals, where your xiphoid process is, where your bottom of your breastbone is, all the way down to the pubic bone. Some of us just have a little diastasis that is at the umbilicus area. Some of us are quite high, so from the tummy button up to the breastbone, and some of us are lower, so from the tummy button down to the pubic bone, and some the whole way through. There are more concerns if you have a deep diastasis. So some of us may have a wider diastasis, but it's not very deep, and some of us can go right into that soft tissue, and that's where we worry about having prolapse or having the intestines kind of pushing up and then creating that tenting, creating that bulging, creating that ridge into that system. So if you've noticed some of that, and you're having a hard time finding a pelvic floor or women's health physiotherapist, one thing you can do is ensure that when you're doing something that you're requiring load, that you're lifting a load and you're requiring those abdominal muscles, to do a Kegel before you do that. So just before, let's say, you lift up your baby out of the crib, you can do a Kegel to help activate your transversus abdominis, that deep core system, and then that can help actually stabilize that fascia that's between the rectus abdominis muscle and give you some support so that you don't bulge out into that tissue. And really make sure that you're doing your Kegel properly. So watch one of my other videos on that so you know how to do a Kegel and you can safely protect your abdominal muscles until you can go see a women's health physiotherapist or your doctor.